So, hey everybody that's joining us today. I am Miriam Bellamy with Whole Family Neurofeedback. I'm today with Lorna Hecht. She's a licensed marriage and family therapist in San Diego. Is that where your practice is? Yeah. So I wanted to start a webinar series as a free resource for parents. We get so many contacts from parents who have a child who is in need of some help and is looking for neurofeedback and thinking about that as a resource for their family. And I wanted to bring Lorna on for one of these webinars. She has studied Bowen family systems theory for many years. She's been in practice for over 20 years. She's a guest lecturer, presenter, she's a writer, and she leads a consultation group for other therapists who are trying to learn Bowen theory. So welcome, Lorna.
Thank you. I want to clarify, the consultation group is actually a nice mix of clinicians and lay people who are interested in applying the theory to their daily lives.
Okay, I didn't know that. That's really, yeah, I like that. Yeah. So what is Bowen theory for the parents who are listening, and why would it be important or helpful for parents to know about?
Well, Bowen theory is, it's different than traditional therapy. And what makes it unique, I think, is that Dr. Bowen, who developed the theory, named it after himself, studied entire families. So rather than focusing on an individual and the problem in the individual, he studied whole families and looked at the way the family unit interacts with one another and came to the conclusion that the human family is actually an emotional unit, that people are so emotionally involved with one another that everything that happens in one person resonates throughout the family. So it's impossible to look at an individual without the context of the entire family for a complete understanding.
So a diagnosis of ADHD isn't just a simple diagnosis when you come to Bowen theory, it sounds like.
Yeah, I mean, personally, I don't think in terms of diagnosis anymore because of that. So what I would think about is, how is that behavior, ADD behavior, inattention or overactivity or hyperactivity, how is that connected to the behavior and the emotion and the thinking in the entire family system, and particularly in the parents?
Can you say a little bit more about what that looks like when you have parents who are coming and they wanted, both Lorna and I use Neuroptimal Neurofeedback. So when parents come to you and they say, hey, my child has ADHD, and they come with these diagnoses, then how do you approach that?
Well, I would talk to them about the behaviors that are being exhibited and spend quite a bit of time thinking about, even diagramming on a whiteboard, how it works. When little Susie is not doing her homework, maybe asking for a lot of help from mother, what does mother do? And how does she talk to dad about it? And how does he relate to it? And over time, I think it becomes apparent to the family that everybody is playing a part in perpetuating a symptom. So, for example, if a child gives up quickly, maybe brushing their teeth or putting on their shoes or whatever, and asks for help from mother, does mom come in and rescue? Does she chastise and then rescue? How long will she wait to let the child struggle through this task? What happens if the child does give up? Is there some shift, or is it ignored? Just the whole dynamic around a behavior in a child that maybe unwittingly, people don't do this on purpose, maybe supporting that behavior. And so often when the parents can get more thoughtful about how they're relating to the child who has the problem, the parents can actually make changes that reverberate to the child.
So this is different from thinking that the parents are causing the problem. Is that right?
It would be easy to hear it that way, I think, but that's part of Bowen theory. That's part of the beauty of the theory, is really tracking family patterns through the generations.
Mm-hmm.
So parents learn how to operate in a family, their parents learned how to operate in a family, and so on and so forth all the way back. So if you want to pick somebody to blame, I think you're going to have to pick everybody to blame.
Well, some people do that, maybe.
Some people do that. I do that on a bad day. Or you can move away from blame altogether and just get as objective as possible about what is happening, mm-hmm. and what might be some ways to modify that.
That is something that I heard Dr. Kerr say in one of the archival videos years ago, where he talked about if there's blame in the picture, and he was particularly referencing self-blame, that gets in the way of being able to be thoughtful about it.
I think that's accurate. Self-blame, I think, goes along with sort of a posture of helplessness.
Yeah.
Actually, just the same as other blame.
Sure.
So yeah. Either position sort of blocks off alternatives.
Mm-hmm. Mm-hmm. So as you know, I study Bowen theory as well, and, mm-hmm. and that is a big draw right from graduate school for me to the theories, because it is an approach or a way of thinking that really isn't about blame at all. Mm-hmm. It really is about stepping back and understanding a much bigger picture, where blame doesn't make any sense. Blame becomes an absurdity because it's too complex. You can't pinpoint one spot and say that caused everything, or that's causing the problem.
I don't want to give the impression that people don't need to be held accountable for their behavior, right? And that's a fine distinction.
Yeah, an important one. Yeah, I think mm-hmm. I'm with you on that. I think, that when people start thinking about that, but particularly the one, I work a lot with couples, but particularly the one who's in that blaming position, they think, we're letting them off the hook or something, and it's not about that. Actually, I think when people stop blame, they become more accountable. That's been my experience.
I think that's accurate. Well, even in a situation where one family member is behaving very irresponsibly, mm-hmm. and sometimes that's a child.
Yes,
for sure, right? So and I've come to the place where I think diagnosis is inherently blaming. Okay. So that's part of the issue that I have with it. So even in the case where one family member really is, kind of off the rails in their behavior, what's the part everybody else is playing? Mm-hmm. So if you're into blame, then it would be like, well, are you saying it's my fault? No, but there's a pattern happening. There's something happening over and over and over again. Mm-hmm. What do you keep doing over and over and over again that's not working? Mm-hmm. And so I think it's empowering.
Mm-hmm. Yeah, that makes me think about process, although I don't want to gloss over that. I mean, that's a big statement. Diagnosis is inherently blaming. I agree with that. And that's a pretty powerful thought, I think, for conventional thinking and for most people.
It didn't start out that way. It was actually kind of the opposite. Because people, if emotional illness was a moral failing, maybe that's how it was seen before. Mm-hmm. And so, well, no, you have a condition, just like if you have pneumonia or a broken leg, you have attention deficit disorder or depression or whatever. So I think that the intention was to take the stigma away. Mm-hmm. But over time, this element of blame, this is where the family problem is located, I think has come in and gotten more and more powerful. When something bad happens in society, people immediately start talking about what is usually called mental illness. Mm-hmm. Mm-hmm. And so that's scapegoating, that's blaming. And that certainly happens a lot with a vulnerable child in a family once they receive a diagnosis.
So one helpful thing for parents to think about is, to consider stepping back from the diagnosis they may have received, and just thinking about their child's behavior more broadly as a kind of a group phenomenon.
The family's behavior.
Uh-huh.
The family emotional oneness. So the very, very fast sequences of behavior, not just behavior, facial expression, body language, everything that goes into how people who are very intimate with one another interact and relate.
And I'm thinking about how neurofeedback helps to slow that down.
Neurofeedback helps to settle it down by lowering reactivity. And it helps to break patterns where people are very oriented toward the past or the future, worry or ruminating, and reorienting to the here and now, which gives people more flexibility in response.
Okay. Yeah.
You have anything to add to that? That's how I think about it.
Yeah, I mean, I think that what I was thinking about was how Neuroptimal is a different kind of approach to neurofeedback, because most neurofeedback really does hone in on a diagnosis, and is a medical treatment, and how Neuroptimal understands that really neurofeedback really is a process in and of itself, is a process, and it's a way to impact family process that's already well in motion.
No, you're making such an important distinction that I don't think has been brought out enough, even in the Neuroptimal community, that linear neurofeedback, there is a diagnosis, and then focusing in on the part of the brain thought to be maladaptive, or whatever term you want to use.
Wrong, right?
And it's known that that can create side effects. It's known that, the brain is up to different things every day. And so if the trainer's always going in and intervening at the same place, that can cause problems over time. But, and Neuroptimal is looking at the whole central nervous system, the whole range of brain electrical activity, and just intervening at points of shift, giving the brain information about its own functioning. And then the brain has the opportunity to reorient to the here and now and do something different than the patterned responses. I think that is a really great extension of therapy with Bowen theory, which is really the same thing, highlighting the patterns, offering the client, the family, the parents, the opportunity to see the pattern and behave differently.
And I think pinpointing the shifts, now that we're talking about this, pinpointing the shifts, I think, is a key piece, because as we understand in Bowen theory, the idea is a person will shift and the family will have a reaction to that shift.
Yes.
They don't shift. And it looks and feels to the family like everything has fallen apart and nothing is working. But in my role, I think being able to point out, it's like, wait a minute, is that what's happening here? Or something shifting that's important to shift? It might be difficult, it might be bumpy or whatever, but that's particularly gratifying moments for me working with people. But yeah, it's a great parallel to Neuroptimal. I didn't think about that.
Yeah, I just think there is the word isomorphic, where the one just flows into the other. I've written a little 4-step saying that I have for clients all the time. And step 1 is doing something different, change. And step 2 is the change back reaction that Dr. Bowen talked about. And I know that change back reaction is always, I don't like what you're doing, stop it. If you don't stop it, here are the consequences. So that's the pushback to the status quo. And that's where the person has 2 choices. They can either give up and revert back to the status quo, or they can stay the course. That's step 3 in my mind. And if they can stay the course despite this pressure to change, Step 4 is the system will change.
Uh-huh. Automatically, almost like a, go ahead.
So every family, everybody knows about this. You know, the first time you say to your 3-year-old, no, I'm not going to put your shoes on for you. I'm sure you can do it yourself. That kid's going to have a temper tantrum.
You bet.
And wherever you had to be at 10 in the morning, you're not going to get there at 10 in the morning because that kid is going to be having a fit. That's the change back reaction.
Yeah.
And so how often does mom go, ugh, I've got this appointment, I give up, I'll put the kid's shoes on. And then nothing has changed.
Mm-hmm.
But if she can stay the course, patiently stay the course, the child will eventually settle down,
mm-hmm.
put his or her shoes on, and the system will have moved to a higher level of functioning.
Mm-hmm. Yeah. Yeah, it's so powerful. Yeah. I'm thinking about, so I'm thinking about this process in families who take a neurofeedback system, do their sessions, and what does this look like there? Does the question make sense? What I'm thinking about are our clients, or actually I'll share even a story of my own family, where we did sessions with my one of my daughters, and the shift, this is our second set of sessions, the shift was dramatic. And I'm mom, so I'm going to call it dramatic. To a scientist, it was like, okay, this is a shift. To me, it was dramatic. A girl going from pretty sullen, very much isolated, to very involved with the family, organizing her room. This is a child who historically has struggled with focus, and a few other things, worry. But she went into organization. She went, organized her room. 8 bags of stuff came out of her room. Okay. It's like, what is happening here? What else? She started setting goals for herself, very affectionate. I mean, just these really lovely shifts that were so delightful for me. My husband didn't see any of it. Like it didn't happen. And so he and I talked about it. And it was a process of a few months of he and I sort of processing and thinking about what happened. Or what, you know, how could he miss it? And it came out that he was kind of caught in a process with her. There was something off in their relationship. He was upset with her. His parental projections weren't going anywhere. She wasn't doing the things he thought she should be doing. And so he thought, well, it's not working. So,
was that the change back reaction in your family? Do you think? Is that how you think about it?
That's a good question. Yeah, I could see that happening between the two of them, possibly. Because her feeling was, she could feel he was upset with her, but she didn't change back. And yeah, go ahead.
Right. So, I mean, it's a way to think about it. And of course, this is unconscious and nobody does any of this on purpose, which is kind of the problem. But that, you know, your husband had certain expectations of how his daughter behaved, and she was behaving differently. And so he had some discomfort with that. Mm-hmm. And she, perhaps without the support of the neurofeedback, she may have go back to being sullen. I assume she's an adolescent-ish type person. So,
yeah.
So sullen would be kind of a default. Why not? Mm-hmm. But I think that's a good example of what it looks like in a family.
Mm-hmm. Mm-hmm. Yeah, I hadn't actually even thought about it like that.
So even when the change is a positive one, that's what's so important about this change process. Even when the change is a positive one, it is new and unfamiliar to the system, and nobody says thank you. Mm-hmm. There's always that pushback.
That's a hard one for me. When I do my own changes and I don't get the thank you.
Right, exactly.
I'm working on that, for sure.
So I'd like to mention it because I have a daughter, and she lives in Los Angeles, and I rented a unit for her to use at home.
Oh, wow.
Because she was a daily migraine sufferer, daily, every day a headache, sometimes responsive to medication, sometimes not, but she got a lot of side effects from migraine medication. And also allergies and asthma. And I wasn't really aware of this at the time, but using her inhaler every day. And she did 10 sessions in 2 weeks, and no more migraines, no more migraines. And then I said, and how about, your asthma? Just sort of randomly, it came into my head. And she said, oh, I didn't even realize I was using my inhaler every day, and I have stopped using my inhaler. So that was a wonderful and predictable response to neurofeedback use.
That people sometimes just miss the shifts.
Well, that part, but also it's known to be very effective with migraine and sleep problems. Not for everybody, but that certainly those are common outcomes. But yes, missing the shifts. My job, your job with the Neuroptimal is to really highlight for people, help them recognize the shifts. Since I have a unit, I'm a regular Neuroptimal user, and I certainly have trouble at times. If I have a bad day, I'm irritated, I think, ugh, that darn Neuroptimal. I'm not cured yet.
It doesn't do everything.
It doesn't do everything.
It's a process. Is that what you're learning, Lorna?
But when I look around at the functioning in the family, I think there's changes. And that's the other piece to family theory, right? One person gets on the Neuroptimal, and there's a ripple effect through the family.
You bet. Yeah. It brings up all kinds of things for people to deal with. And then also sometimes it just helps people deal better. And I do want to just throw out the disclaimer that Neuroptimal, we do not treat any illness. We don't treat migraines. We don't treat asthma. There's nothing like that. We don't know what's going to happen. Neuroptimal is brain training. And when you optimize the brain, a lot of different shifts happen in a person, mentally, emotionally, and physically. So I just want to clarify that too.
You're absolutely right. You're absolutely right. This is not a medical treatment.
Yeah. And that's hard for people to get their minds around too. We really have this medical model mindset, of a fix. And really this is a process. It's a very powerful one. It's a very powerful tool. Yeah.
Well, maybe it's best thought of in the category of other wellness approaches and applications.
Yeah, I think that's right.
So
go ahead, please.
Well, I just, you and I had talked about what it would look like to use Neuroptimal to help a child in the family, and what that would what would be most beneficial about that. And you and I have talked about it a little bit offline.
Yeah.
So we were joking that if somebody wants to take a unit home with them and use it in the family for their child, that for every one unit, one training session the child has, mom should have 2.
Yeah. Actually, when we rented our system, I think it was 1 to 3. I did 3 sessions to every one my daughter did.
So during that time period and that shift in her behavior, you had probably 3 sessions for every one she did.
I absolutely did. I had 30 and she had 10.
Oh, okay, perfect.
Yeah.
Okay. It's too bad you couldn't be your own control group and go back and only you have the sessions and her have none.
Yeah. Yeah, I hear that.
And see if you got the same result.
Yeah, that would be a research study, wouldn't it?
Mm-hmm.
Yeah. Yeah, I think one of the things you and I talked about was for a parent, when they're thinking about it, what is the realistic need of the child? And what are your projections or your fears? Mm-hmm. I think that's a big one to think about and really put some time in as a parent. I know I've spent years really trying to constantly evaluate that and step back from it. When you have a child who needs help or who seems to be struggling, you know, it gets your attention as a parent.
How does one sort out the anxiety that's tied up in love and caring and worry from reality, the reality needs of the child? And the closer one can get to tending to the reality, the better.
Yeah, and I think it's a closer. It's not like you're there and you're dealing with reality. You know, it's an approximation always.
Oh, one's best guess.
Yes. Yeah. And for me, I think that's where the theory has come into to be helpful as well, is being able to step back and have a body of knowledge that I can use to think about, you know. So I just don't get lost in it or lost in conventional thinking. I did for many years, and it, you know, landed me in brick walls every time. So
still, if anxiety, my family's having some challenges right now. My mother-in-law has been in the hospital for a couple of weeks. And so it's an anxious, inflamed family system right now. And my husband and I had a kind of funny conversation about who can we blame at the hospital. We got to figure this out. So when there's enough stress, that cause and effect thinking, that moving into blame, you know, it's automatic.
Yeah.
There was a little humor involved, so that was a change.
That's a big help, I think. Yeah. When you can step back enough, you can get to that lightness mode. I think that makes a huge difference all around, which Neuroptimal helps with. Yeah.
What I've heard described with the Neuroptimal, almost universally, is a better ability to recognize one's own reactivity. Maybe not have it, but to see it and identify it as anxiety that's driving the physiology and the behavior.
Yeah, I think that's a key thing too, is just the recognizing. You don't have to fix it or stuff it or whatever, just that, and even recognizing it out loud. You know, I realized I was really losing my mind last night. Sorry about that, or whatever, you know. Even to the child, I think that makes a big difference, as in my family. So this feels like a beginning conversation for you and me. So I'd love to have another webinar in a month or so, and we can continue this on this subject or another, but we'll see what kind of feedback we get and what the next piece will be.
I'm absolutely game. It's been a pleasure to talk with you.
Good. Yeah, me too. Love it. All right. Take care, Lorna.
Thank you.
Bye, everybody. We'll put some information out about Lorna's practice, which is in San Diego, my practice, which is actually across the United States, and you can get in touch with either one of us. And thanks for listening today. All right. Bye-bye.